Is nursing really a calling or not? This sentence, nursing is a calling, is something I've been hearing since my very first day as a nursing student. And sometimes I feel I understand why some people say that nursing is a calling, because to be very honest and sincere, you need to understand, or you need to have this empathy to do your job well as a nurse, particularly as a bedside nurse. Remember, not every nurse works on the bedside. And when people come up to say nursing is a profession, I completely understand, because just like every other profession out there, there are rules, there are guidelines, there are expectations, there are, academic expectations, so many things that you're expected to do. You don't just say, oh, because nursing is a calling and I feel I have the calling to become a nurse, they're just going to hand you that certificate and say, oh, you have the calling, now go ahead, go into the hospital and nurse people back to health. It doesn't work that way. You still have to go to school. There's a lot of science that goes into it. There's a lot of art. In fact, there's so many things there are so many things rather that goes into nursing beyond just it being a mere calling. So when people say nursing is not just a calling, I completely understand. You see these two concepts and we need to balance it. Mind you, this video is based off my personal opinion. You are welcome to say anything you want to say in the comment section. Add, remove, argue, counter whatever I've said, bring up your own points. It's a free word in the comment section, because I feel we should talk about this. Hi, my name is Imoli Ayabusari. I am a Nigerian registered nurse and midwife, and I'm also a United Kingdom registered nurse. On this channel, I talk about nursing, healthcare, and my lifestyle generally as a nurse. And in today's video, I am discussing this statement of nursing is a calling. Is it really a calling or is it not a calling? So on the part of it being a calling, I think I completely understand because of some reasons. And the first reason is intrinsic motivation. You see, as a nurse, you have to have this internal desire to care for other people before you can succeed as a nurse. Because I'm going to be honest with you, at least I've been at the bedside now for about 4 years or more. And I know that sometimes it can get very emotionally daunting to care for people. It can be very, very demanding, especially when you have like 8 different people you're trying to care for at the same time. You have the doctors you have to work with, you have the pharmacists you have to work with. You're not a robot, you're a human being. You have your own personal feelings and emotions. So you have to enjoy your job, have that internal motivation, and like you need to have that desire to care for people. If not, you're not going to do your job well, because you can just choose to just focus on the paperwork and leave the person. Because in nursing, there's like the patient and nurse interaction, and there's like the numerous paperwork that you have to do. While the paperwork might be very easy for any random person to do, is it that patient to nurse interaction? Not everybody can do it. So I understand when they say nursing is a calling from the point of intrinsic motivation. Another thing is religious and spiritual beliefs. Let's be honest, historically, nursing was linked to a lot of spiritual and religious beliefs. You see, even if I'm a Christian, actually, I was raised in a Christian home, so I have seen stories of all those Hebrew women that were delivering, stories of midwives in the Bible and all of that. So there's a lot of religion and spirituality that has been part of nursing before the era of scientific nursing, the era of Florence Nightingale, Mary Seacole, and all of that. So there is a lot of this mindset that you have to have this spiritual guidance. So that's why you see a lot of nurses are very religious, and I know a lot of matrons are very religious. See them in churches, see them in mosques, like they are very religious. You hear things like fellowship of Christian nurses, fellowship of this, fellowship. At least in Nigeria, where I'm from, we have a lot of that. I don't know for other countries. So you find that a lot of nurses are very active in church, because we are expected to still demonstrate this spiritual connection to God, to be able to take care of people and all of that. So I understand from that point too. I understand when people say nursing is a calling. Or am I wrong? The third reason I feel people always say that nursing is a calling is that a lot of people became nurses because of their personal experience. Some of them it's because, probably they took care of someone that was sick, or they watched nurses take care of one of their relatives or someone very dear and close to them, and they'll get that desire, that motivation that, oh, I want to be in this line of profession, I want to care for people, I want to be a lifesaver, that personal decision, which also goes in line with my first point of intrinsic motivation to become nurses. So when you look at it from all those angles, nursing can be regarded as a calling. But you can't just go to any university and just say, oh, I have received the calling to be a nurse. I feel the motivation, I feel the spiritual push to become a nurse, and they will tell me, oh, come, and they will parade you on the graduation gown, wear academic gown for, and say, go and be a nurse. You have to learn how to be a nurse. Okay? You need to learn how to be a nurse. Trust me. And learning how to be a nurse doesn't, like, the process of learning how to become a nurse does not care about your calling, doesn't care about your motivation, your desire, whatever pushed you to become a nurse, or whether you're a pastor, Mrs., or whether you're the wife of a pastor. The process of learning how to become a nurse doesn't care about all of that. The process of learning how to become a nurse only wants to know if you're smart, if you can, work under pressure, learn under pressure. The process of becoming a nurse is very, very, very critical. And I'm not saying this to glorify the profession because I'm a nurse, but I've been through the process. I've had friends who have been through the process. I know people who could not even successfully pass through the training of becoming a nurse, then had to leave. So I can tell you for a fact, no matter what people say, oh, nursing is this, nursing is that, nursing is not for everybody. Not everybody can successfully pass through those training, because the training process is very rigorous. I'm not saying this to scare anyone who wants to become a nurse, but the training process is very, very rigorous. So let's talk about nursing as a profession. So the first thing is that nursing is very, very practical. See, forget all this, oh, I feel like I'm called to become a nurse. If you don't know what to do, zero, you're out of the system, you get kicked out very, very fast. And I'm not saying that to be mean. I'm not trying to be very, very like wicked or something. But the fact is that if you don't do your job well as a nurse, you're not going to be there. It doesn't matter if you feel that leading. That see, your desire to become a nurse is not what is going to make you a good nurse. It is your ability to actually perform that role well. You need to understand a lot of medical terms, understand drugs, understand anatomy, understand physiology, understand aging, death, all those, so many things. Now, I'm speaking specifically about bedside nursing. Let's not even go into things like research. Let's not talk about things like oncology nursing. Let's not talk about so many non-bedside roles, infection prevention, like so many, even telehealth, things like nursing informatics. Let's see, there's so many other things that are not even at the bedside. All I'm talking about is even at the bedside. So you need a lot of academic progress. You need to be very, very smart. You need to understand your job and be able to do it well. So at that point, the calling doesn't really matter at that point. So at that point, see, nursing is already a profession. Do you get my point? Another thing is expertise. You see, at some point, just like every other profession, you become an expert when you keep doing the same thing over and over again for a very long period of time. So that makes nursing a profession, not just a calling. The fact that you feel that you are called, or you feel that the sound of your call is so strong, or the sound of your call is stronger than another person, maybe, oh, because I witnessed my grandmother being taken care of by a nurse, so I feel like my calling is stronger than somebody that just decided to become a nurse because of what she saw on TV. That doesn't make you an expert. You need to know what you're doing. You need to consistently do it and be an expert at what you're doing. So at that point, nothing is, your calling doesn't really, like, your calling mentality doesn't really come into that. At that point, nothing is regarded as a profession. Another thing is that just like every other profession, there is burnout, there is stress, there is a lot of, you have to keep learning. There is continuous learning. You have to keep reading, go for one course, another course, revalidate, like talk about things like licensing, talk about so many things that goes into other professions. So it's not just like you're calling, you come into the school and be like, nothing is a calling, I'm called. The fact that you are called does not mean like you get licensed. So when people bring this argument of nursing is a calling and nursing is a profession, I think when I look at it from both sides, I understand. But people should stop using that nursing is a calling as an excuse to treat nurses bad. And this is what I'm saying. When you talk about salaries of nurses, when you talk about pay, how they are placed in the healthcare sector. I know in some other countries it is better, but for someone who has practiced like two different places, I've seen different challenges that nurses face in different forms. No, there are some countries where the challenges. Let's just say you have like three different countries. The nurses in these three different countries are going to be facing different challenges. But most of these challenges, if you look at it well, some people always use that excuse of, oh, nursing is a calling. You're not in this for money. You shouldn't be thinking about the money. And nursing is not this. My dear, if I want to get that professional course, if I want to be to get that qualification to be able to take care of you better, they're not going to give me the knowledge for free. You understand? Like, people don't just go to school. Like, it's not free education. If nothing was like free education, maybe I'll understand. But education is not free. The textbooks are very expensive. The licensing exams, very expensive. In fact, the stress of the job, oh my god. Now, I am not complaining. I love my job. Like, I say it a lot, even though some people think I might be lying or I might be exaggerating. I genuinely love my job. I smile a lot at work. Sometimes I sing for my patients, I dance for my patients, both in Nigeria and here in UK. I've always loved my job. Sometimes people will be like, all these challenges that nothing are facing is like, let's say, no, reach yourself. Like, can't you? Oh my god, I'm speaking pidgin. Sorry. Like, can't you feel the challenges that other nurses are feeling? It's just like you are so oblivious of what is going on. I'm like, no. I feel I face the same challenges most of my colleagues face, but it's just that genuinely I enjoy my job. But let's be realistic, nursing is not free. I didn't take a flight from Nigeria to UK, right, on my nursing exams, and they just say, oh, because we feel that you are called and you love your job and you enjoy your job, you can come and work here for free. No, I had to pay. And let's also understand that the calling part, I can't tell my landlord that, oh, take my calling to pay my bills. No. These people that are working in the hospital and are taking care of other people, they have bills to pay. And the calling doesn't pay the bill. Because it would be very, very, I don't want to use the word stupid, but imagine my network provider telling me, oh, Mole, it's time to pay for your wife. And I'm like, oh, take my calling as exchange. Or when you come to the hospital, I use my calling to take care of you. Does that make sense? Or I want to eat, I go to the grocery store and I want to shop for groceries. And I'll be like, oh, I don't have money, but take my calling. Or when you come to the hospital, I'll use my calling to take care of you. It doesn't really make sense. So in a nutshell, I don't like when people try to use this nursing is a calling, you shouldn't be bothered about money as an excuse to treat nurses badly. Come on, we are human beings. And the same bills you have to pay, we have to pay them as well. We have to eat the same way you have to eat. It's like, this is not the 14th or the 15th century where, you know, we're not in the era of nuns. We are not nuns, we are not monks anymore. Like, we are actual people. We go to school. I'm not removing the fact that we have to still like feel the empathy, the desire, and intrinsic motivation to be nurses. But this is not the 18th century, okay? We are not knights anymore. We are not nuns. We are not monks. You get? We have children. We have bills. We have husbands. We have kids. We have wives. We have houses. We have cars to fill. You understand? I can't trek to walk. All right, I think I've made this video so long, but I want to hear your comments. I want to see your comments. What do you feel? Should we forget the fact that nursing is a profession, or we should stick with that calling, that era of nuns and monks? Or what do you feel? And I'll also leave the links to my videos up here. I'll see you in the next one. Bye!